So welcome everyone. Welcome to LMHI 2021 Global Colloquium. Here we are going to start with the theme Experiences in Cancer and Chronic Disease Management. We have with us the chair, Dr. Dr. Sarper Diler. He is the certified homeopath of the Turkish Ministry of Health and European Committee for Homeopathy. He has written over 200 scientific articles. He is running preclinical and clinical trials on personalized diet, cancer-related fatigue, and homeopathy. We welcome Dr. Diler and we also thank him to be the chair of this session. Along with him, we have the moderators, Dr. Rekha Thomas and Dr. Mohit Mathur. And without any further ado, we shall be calling upon our speaker, the first speaker, Professor Tapas Shaktipada Kundu from India. I think he is away from the window. So shall we call upon our next speaker meanwhile? We can coordinate with Dr. Tapas after this.
Yeah.
All right. So for our next speaker, rather our first talk, we have Ms. Li Wen Chen from China. So I request Ms. Li to kindly take it forward. Request you to kindly share your presentation.
Thank you. Thank you to LMHI for inviting me to have presentation here. Today, I would like to address the subject of individualized homeopathic treatment in severe hypertension in Hong Kong. We're talking about highlight in snack remedies.
好高興 LMHI 可以邀請我喺度做演講啦。咁我哋會講以順勢療、以個人化順勢療法治療處理香港嚴重高血壓嘅。咁我哋亦都會提及蛇類療劑嘅一個亮點。
Okay, first, I was talking about the background, the total prevalence of hypertension was 27.7% among persons aged 15 to 84, 25.5% for females and 30.1% for males.
咁我哋而家講下個背景先。高血壓總患病率係27.7%，年齡咧係在乎於15至84歲之間，女性係佔25.5%，男性就佔咗30.1%。
Okay, the demand for more integrated care like homeopathy is rising as the rate of successful control below 140 to stroke 90 remains poor.
咁由於如果血壓要維持喺低過140，下壓維持低過90嘅話嘅成功控制率仍然都係好低，因此對順勢療法呢一啲咁樣嘅綜合護理嘅需求亦都正在上升。
And let's talk about the severe hypertension in adults.
咁我哋就講下成人嘅嚴重高血壓問題。
It is defined by systolic blood pressures over 180 and or diastolic blood pressures over 120.
嚴重高血壓定義為上壓大過等於180或下壓大過等於120。
It is associated with a variety of acute life-threatening complications, which include hypertension, encephalopathy, retinal hemorrhages, papilloma, or acute and subacute kidney injury.
咁呢個係同一啲各種急性啦、危及生命嘅併發症有關，其中包括高血壓腦病、視網膜出血、視乳頭水腫或者急性和亞急性腎損傷。
But the much more common presentations is the relatively asymptomatic patients with a blood pressures in the severe range.
但係更常見嘅表現就係血壓喺嚴重範圍之內，但係相對冇症狀嘅患者。
They have relatively mild headache with no signs or symptoms of acute and organ damage. This is a group we seek help from homeopathy in Hong Kong.
佢哋有輕微相對嘅頭痛啦，但係就冇呢一個急性末梢器官損傷嘅跡象或者症狀。咁呢一類病人亦都喺香港係會尋求順勢療法嘅幫助。
And because of the limitations of time, we just only can share 2 cases of severe hypertension improved with snack remedies.
由於時間限制啦，咁所以我哋喺呢度淨係介紹2個案例，係關於嚴重高血壓患者服用蛇類療劑之後情況改善。
Patients with persistent high blood pressures, SPP over 180.
咁一個持續性高血壓患者 SPP 高過180。
We have case 1, a 57-year-old female. She refused to take any conventional medications.
個案一57歲女性，佢係拒絕服用任何常規藥物，
and has persistent SPP over 180 to 200 for over 1 years since the death of her husband.
自從丈夫去世 ，SPP 180至200係持續咗超過1年以上，
And she got no end organ injury yet.
暫時冇呢個末梢器官損傷。
And we have a second case, a 52-year-old male.
個案二咧就係52歲男性，
He refused to take any conventional medication.
佢拒絕服用任何常規藥物，
Persistent SPP over 180 for about 3 years since his new job.
自從新工作以嚟咧，佢個 SPP 係超過180，持續約3年時間。
Recent onset unstable angina.
咁呢個佢近期係有不穩定型嘅心絞痛，
CT angiogram, severe stenosis over 70% as proximal LAD.
CT 血管造型咧 LAD 近端嚴重狹窄，大概係70至99%。
And patients refuse any operations and
病人
seeking
拒
help from homeopathy.
病人拒絕用任何手術，所以佢哋去揾順勢療法幫手。
Okay, case 1, ladies, she's responded well to NADRA.
咁個案一嗰個女士咧對 LADRA 反應良好，
Intercurrent use of Bacilla Morgan back with symptoms agreed.
咁當如果與摩根 B 嘅症狀一致嘅時候咧，亦都會同時使用摩根 B。
And SPP go down to average 150 to 160 in 3 months.
SPP 喺3個月內降至平均150至160。
SPP go down to 140 to 150 at 1 year follow-up.
1年後嘅隨後跟進 SPP 降至140至150。
And the second case, male, he's responded well to elapse.
個案二男性呢一個咧就佢對 relapse 反應良好啦，
Angina improved since the first month.
心絞痛亦都由第一個月開始得到改善。
SPP go down to average 160 after 9 months.
9個月之後 SPP 下降到平均160。
And SPP go down to average 120 to 130 as 2 year follow-up.
2年之後嘅隨後跟進 SPP 下降到平均120至130。
Repeated CTA at 2 year, mild systolic and proximal LAD.
2年之後覆查 CTA 近端 LAD 係輕度狹窄。
And what is the similarity between the two cases?
咁究竟兩個案例之間有咩相似性呢？
Okay, we talk about alike features in snake remedies.
我哋而家講下蛇類療劑嘅一個相似特徵。
The patient will have strong sense of own territory and competition,
個病人佢對自己嘅領土同埋競爭係有強烈嘅意識嘅，
and they're feeling dominating and being dominated,
佢哋覺得被支配或者支配，
and jealousy and suspicions.
妒忌同猜疑。
Sometimes they need to be discussed in order to survive,
有時為咗生存，佢哋更加需要偽裝起嚟，
because sometimes they feeling being ambushed.
因為有時佢哋覺得被伏擊。
And we are talking about the differentiating symptom of the two cases.
我哋會講下兩個案例嘅症狀區別。
Okay. We can see that in case 1, the main theme is all of her symptoms started when her husband has passed away and feel grief.
我哋可以睇得到啦，喺個案一所有嘅疾病重點咧，都係由於佢丈夫去世之後咧，佢感到悲傷所開始嘅。
And we can see this in this rubrics. Few snake remedies useful in this area include nausea, laxatus, elapse, and courage.
我哋喺呢一啲選項當中咧，亦都有少量蛇類療劑係喺呢個範疇適用嘅，包括有 LAGA、laxatus、elapse 同埋 courage。
But in this case, what is more important is the main feature is the strong responsibility, the strong sense of duty. This theme is very typical in larger patient.
但係喺呢個個案裏面，更重要嘅嗰個主旨嘅特點咧，就係強烈嘅責任感。咁呢一個主旨亦都係 LAGA 裏面比較典型嘅。
And she has swollen puffiness over her feet and fingers.
佢嘅腳啦同埋身體咧都係腫脹浮腫。
Edema is also a feature of nausea.
水腫亦都係 LAGA 嘅一個特徵。
And these are a few things that we may look into when we suspected some patients with snake remedies. If they got this feature, we may consider nausea.
當我哋懷疑某一啲病人咧係需要用蛇類療劑嘅時候，如果佢哋有呢啲特徵，我哋都會考慮到，而之後亦都會考慮用 LAGA。
Okay, the second case elapse.
第二個個案 relapse。
The main themes of the case of is the fears of falling.
呢 呢個個案嘅主旨係恐懼下跌。
In physically or mentally, like in the dreams of falling and fear of falling in social position.
喺身心上咧，就好似會發一啲墜落嘅夢啦，或者害怕社會地位下降。
And the main themes of ELEX also fear of falling.
而 ELEX 嘅主旨亦都係恐懼下跌。
Then the patient has heart pain, palpitations of heart, and also have stomach distension.
然後咧，患者其實都係有心痛、心悸同埋胃脹嘅。
And also, ELEX has a strong affinity in heart region and stomach.
而且 ELEX 喺心臟區域啦同埋胃部都係有好強嘅親和力。
That's why we choose ELEX for him.
所以點解我哋會揀 ELEX 俾佢？
Because of the limitations of time, we have no time to discuss about a topic about monarch and Bauno. So we hope that we have more chance to talk about this topic to you.
由於時間限制啦，咁我哋今次係唔可以討論到 monarch 啦，同埋呢個腸道病質藥。咁我哋希望下一次有機會可以再同大家講呢個 topic 啦。
Okay, thank you for your attention.
多謝各位參與。CPD 曲咧係 HF099G，HF099G。Thank you.
Thank you.
Dr. Lee, it was indeed a very, very good presentation. And now I would request Professor Dyler to please share your comment about this presentation.
Yeah, I was muted. So my question, do you hear me now? Do you hear me?
Okay.
Okay,
Yes,
good.
yes.
My question would be, what is her next step to take? I mean, this is a good case studies, but what should she do to elaborate this study so that we can conclude something out of it? Is she planning to have some cohort studies, case control studies? Otherwise, I like the case reports, but I mean, what's the next step?
Okay.
Yes, I can hear the voice. Yes.
Professor Dyler, I will request, can you repeat
Sorry, could you repeat?
Professor Dyler, can you repeat?
Okay, I'm repeating. Do you hear me now, Joanne Lee? Do you
Yes,
hear me?
okay.
Okay, so
Yes.
I said this is a good case studies. So my question is, what is the next point? I mean, how can we make more studies with cohort studies or case control studies to deduce? Did you have any plan for the future to do some sort of detailed work on hypertensive patients?
Case report got its own value, and it would be a vast importance that we have to publish good quality case report. Monocritical, what we are criteria are what we are teaching our students now. Publishing a good case series report would help to give more information to the further.
Okay, thank you.
Oh, thank you. We would like to collect enough case report first.
Sure.
Thank you.
Thank you.
I would request Dr. Leven Buddha to please share his comment about the presentation.
Who are we waiting for now?
We are waiting for Dr. Leven Buddha.
I don't think so that he is online. I don't know. I haven't checked for the last couple of minutes.
So,
But
okay,
he might
now,
not be. We can continue.
yeah, Dr. Tapas Kundu is here. So, I would request Dr. Tapas to please start the presentation.
At the outset, I thank you, the total LMHI team, for allowing me for these presentations. These particular presentations we are giving for as a cohort study on a multicentric trial carried out at Nasik and Mumbai in India and Surat in India, where we see that the particularly taking care of the hemophilic patients whenever they suffer from hemarthrosis leading to excruciating pain, as well as the joint in course of time got disabled. Next slide, please. If we see the prevalence of the hemophilia patients, as per the Global Hemophilia Survey of 2018, we get that there are the number of patients in India, is 20,708 in a population of more than 130 underdiagnosed and underprivileged hemophilia patients as estimated in a population of more than 1 billion. So this many numbers of the patients got diagnosed and giving the India as a highest positions in the world as far the hemophilia patients is concerned. So quite naturally is a major concerns of this one economically, there's one country, there's one resource limited country like India, where you see these patients are need to be taken care of by the use of certain alternative way. Because the cost of the care, particularly for hemophilia patients, if we look upon, that they are nearly more than lakhs of 2 million of rupees per patient per year, and majority of the patients cannot afford to do so. And second important matter, whenever they are suffering from the bleeding, they usually see that takes a long way and they travel some way to reach to the tertiary and other hemophilia care centers in India. So with these specific intentions, actually this particular type of project for the patient's benefit system, they were initiated. The challenges remains as we have to, by hook or by crook, we have to stop the bleeding quickly. We have to reduce the pain as early as possible and preventing the joint damage, making the patients fit and functional, and to reduce the joint related disabilities and which make them crippled in the remaining part of their life. So the objective remains as to assess the effect of the homeopathic medicines on pain and acute hemarthrosis for hemophilia when the factor concentrates are not available and the patients are normally which they use the drug, the paracetamol, which is proved to be inadequate. The patients of India, they are not able to use the other painkillers, particularly opiates and other aminocaproic acids like substances. They are not very easily available in India. So patient mainly depends on paracetamol. So the materials and methods which was used, a retrospective study by the analysis of the bleeding diary of these patients were taken into considerations of Nasik, Mumbai and Surat chapters of India, and where we see nearly somewhat 343 patients out of the screened 430 patients were selected, of which 23 patients has taken factor concentrates from elsewhere, and quite naturally they are not taken into the data, whereas 38 patients had incomplete data and 26 patients had no bleed in this particular period of time. So I have told you that 343 patients were included in the study. The protocol which was being followed, at level 1, the Hemamelis virginia mother tincture is usually taken into considerations. Second level, the administrations of acutely indicated homeopathic medicines were taken based on acute totality. And in the level 3, that administrations of the individualized homeopathic medicines, which was totally taken up by the homeopathic procedures of whole case taking, were being applied. By the way, this particular case, add-on homeopathic protocol is like that of first the rice is which is as the standard management, rest immobilization, cold application and elevations as needs to be mentioned, as you are seeing in the diagram. Phase 2, in the phase 2, we are using the mother tincture, Hemamelis virginia mother tincture that we are using, and the particular places where you see the medicines how to be used, excepting the intracranial bleeds, the patients are not taken any amount of risk and they are supposed to rush to the tertiary care center of the country. The add-on protocols, you see that the patient presents with hemarthrosis, that means there is a huge bleed in the inside the joint that give rise to the problems like that of a swelling, inflammations, the bleeding that is having some compression effects, and the blood which are having some inflammatory hyperplastic changes are there. In course of time, the joint got damaged by the damaging of the synovial membrane. The cartilage are also damaged in course of time, and in course of time there is further changes like osteophyte formation. So quite naturally, the drugs which we have selected, and ultimately in course of some 12 years of our study, we found out that these drugs are tremendously effective. At the time, patients are usually see whenever the patient comes to our center first time, we are giving a kit containing some 28 medicines, and their indications have been written over the envelope, as you see, and the patients are provided with this particular kit. They are trained, but preferably with their own easily available languages, so that they can use the medicines as and when they can require. Usually the patient's assessment systems are done by using the Wong-Baker's pain rating scale and the other factors like that of dimensions of the swelling, this measurement. And as you see that, the data outcome is being taken from the diaries. This patient is showing that almost in all cases, the p-value substantially is significant, like that of 0.0001. So after getting 6 months of the therapy, these patients have improved like this. Tremendous improvement has been taken like this. They got the better results like that of pain reductions. Fast जा अब उसमें से आगे चलेंगे वो डायरेक्ट ठीक है ना तो लेना चलो आगे जाओ so patients, they have got bleed at the knee joint bleed, ankle joint bleed, and shoulder joint bleeds. Usually see that the hours has been given, and there the p-value is, as I have told you, 0.0001. Ankle also showing the same results, whereas the post-treatment, these many patients, they have taken the time requirement for the patients. Even after rice and paracetamol, the condition did not get improved. Wherever you have seen that the homeopathic medicines, a comparison study was being carried out. Next. Wong-Baker pain rating scale is showing that the p-value stands for, after giving homeopathic medicine, 0.007. This data is very much scientifically significant, but for a better understanding of the particular purpose, we like to show you one single case as an illustrative case. This particular patient has got a bleed of 12 years of age. Factor deficiency is less than 1%, severely hemophilic. This patient has a bleed in his joint. As you see, the swelling joint has been shown. Next slide. This is the child. Okay, next. Next slide. The swelling is enormous, affecting the right knee as compared to the left knee. You can see the condition. Now see the patient's behavior during the time of the excruciating pain, very much abusive, and pressing very severely on the affected area, above the affected area. Unit pressure is tremendously high. So the totality was being taken in this particular format. We are having a format. And the medicines was prescribed after considering all these important rubrics. The medicines was prescribed. Repertorial evaluation. Syncona officially 30 was given. 3 doses, 3 hoursly. Now see the result. So next day the patient came. The condition of swelling tremendously reduced. The girth became very less, and the patient could stand. The abusive patients with a very nice smile. Similar cases have been observed. If you look upon this particular joint, you see that there are huge amount of the bleed, and this way see almost the cases have been improved with a acutely indicated totality. In the research, another very important question is usually been raised, like that of what happens after carrying out the research and how this moves. Like, so these conditions is that as on today, previous slide. As on today, you see the number of the patients have drastically been increased in 6 multi-centers, and the head office being Nashik. So total in 7 centers we are working. In Nashik center, 554, in Mumbai center 377, in Surat center 104, Amravati center 86, Thane 16, Nagpur 114, and in Dhule 19 patients have been enrolled, which is around 5.96% of the total hemophilics enrolled in the hemophilia register. So a huge number of the sample size has been created by the care being provided by the homeopathy. And the most important that it has a huge benefit in the medico-social outcome, that usually before this particular hemophilia care, an organized trial been carried out with this particular team. Hemophilia was not having any, or there was no study has been carried out in the past, and the usage of the homeopathic medicines were negligible. After this particular group has been taken over and the patients are using the medicines, so it comes down to 42.3% has been reported by this big publications. If you now the team which is involved with the matters, that the director of ICMR, immunohematology, National Institute of Immunohematology, Dr. Kanjakso Ghosh, with all my teams, they are working very hard, and we could achieve such a brilliant result. The thing is that we see that we could make some changes. To conclude, I want to say, go to the people, stay with them, love them, learn from them, and finally achieve the goal. Thank you.
Thank you. Thank you, Dr. Tapas Kundu. Your topic was indeed of great significance. And now I would request the chairperson, Dr. Tecker Deller, to please comment on this presentation.
Yeah, Dr. Tapas, this is a very nice presentation and a very nice work. I congratulate you and your team for this. I don't have a lot of questions for you, but it's just that if you can just share your screen of the repertorization page so that everybody could see what you have taken as rubrics, that would make people,
yes,
I think, more happy. And if you extend your study to International Hemophilia Organization and do a sort of multicentric but international joint work, so that the conventional medical world would understand the importance of homeopathy in hemophilia.
Yeah, sir. This is the way we take the history. Past
Okay.
medical history has been taken by the episode, number of the episodes patients has got, and the development of another important factor, the inhibitor. Usually the children, they are whenever repeatedly infused, they develop a substance known as inhibitor, which is antagonist with the factor. Whenever you are giving the required factor concentrates like that of in a hemophilia 8 patients, if you are giving factor number 8, that do not works. So on that time, usually as World Federation of the Hemophilia directs, so we are having a bypass system. And the substance which was used, that is known as FIBA, factor 8 inhibitor bypass activity. Similarly, the 9. So this particular factor concentrates is usually say for 10 rupees per international unit. And similarly, wherever we enter into the factor FIBA, that is usually see that several times high. Whenever we started the work, on that time, the cost of the FIBA was 90 rupees per unit. So the cost of the hemophilia care, which was approximately 0.2 million rupees per annum, that become 9 times. And in a exorbitant way like that of whenever several lakhs of the factor required, millions of factor required, when you see that multi-millions it got happens. So the patients in India, which are approximately, we have calculated that 90% of the patients, they are living in villages, and their annual income in Indian rupees is within 40,000 rupees. In Aurangabad, like place, there is a patient where you see it's a extended family with 23 members, and of which 18 are hemophilics. So we can understand that actually the financial load is these patients. So these patients, that is the reasons in acute emergencies as well as considering their emergency, because on that time they are not able to move from the place. So this is one factor. And second important factor, the cost. These patients and the authorities, they were trying to find out another way, economic way, so that the patient have an outcome. So this is the main reasons. By the way, sir, I want to let you know that we have already developed the multi-centers with the generous hemophilia societies, which is a part of World Federation of Hemophilia. That is there. In India, it is quite possible, but in the other countries, they are actually rich countries, and there is usually not possible. Such type of trials are not being initiated. And regarding the other works that we have got a numbers of publications by this time, nearly 11 publications as well as case histories that we have published in national and international journals. And the more important research question is that we should have a case control study or like that of RCT, randomized control trial. So for your information, sir, with the due help from the Central Council of Research of Homeopathy India, and especially with the two great former and the present director of this one, CCRH, Dr. R.K. Manchanda and Dr. Anil Khurana, we could have developed a center at Nasik, Motiwala National Homeopathic Medical College, and there the which one randomized control trial is on. It is in progress. And the repertorial evaluation, whenever we have raised like that of, first of all, the matter happens following an insult or the injuries. So this is then general injuries has been taken, general injuries, extravasation of the blood with the child. Whenever they came, if you see the gesture of the particular type, you are not allowing to touch. Along with me that there was actually the hematologist was there. She wanted to infuse the factor, and the child was not allowing and abusing her. We have taken the matter. So touched aversion to, looked at, cannot bear to be looked at. Pressure, hard pressure, I have shown you that as the finger end was used, so naturally unit pressure was high. So the hard pressure is been there, and the standard rubric which was available in the repertory, that blood non-coagulable. And considering that, usually see China is the only indicated drug is coming, and the particular mechanism is the behavior of the China, and the result is in front of you. So beautiful result. So this is the acute totality. Whereas these patients, whenever they are non-bleeding phase, or when the patients is the acute emergency is over, we are using the total other constitutional pictures, including the most important, the factor infusion history. Repeated infusion factories, we take a rubric like that of elements from vaccination type. And there are many times usually see Silicea, Thuja like drugs comes. And that gives also, that restricts the particular disease progress like that of disabilities and helps a lot.
Okay, thank you.
Thank you, Dr. Tapas and Professor Delaire. The next speaker is from Spain, Dr. Juan Vidal-Jove. He will be speaking on the study on homeopathy integrated in a comprehensive oncology clinic. Over to you, Doctor.
Okay, thank you very much to the organization to allow me to present our work. I'm going to share the screen now. Well, the idea of presenting this presentation it's to face the reality, which is what we really find in our daily life when we confront patients with cancer. So when we are going to deal with patients with cancer, it is not easy, and we know that patients are going to have different treatments. Patients are going to go to the hospital, to the main oncological system, where they're going to have clinical and pathological diagnoses, when they're going to be evaluated by medical oncologists, and when they're going to be treated by the rules of tumor boards, and they're going to have follow-up controls. So in our case, we try to manage all these together at the same time. And at the same time, we're going to take the patient as a homeopathic case taken, and we're going to approach that as a classic homeopathy and add some complementary support to deal with all the side effects and with all the approaches that the complementary therapy can give to us. So the patient that goes to a conventional oncology approach has to suffer things that we, from the homeopathic point of view, probably will not agree. So the need for biopsies is something that we have to consider. the symptoms of the disease managed with the symptoms of the treatments, the disease that's measuring volume, and the stage and response progression that's measured in this volume. So sometimes that does not go in favor of the evaluation of the case from the homeopathic point of view. The decisions that are made on the oncological setting are on group, are made by the tumor boards. Sometimes patients enter into clinical trials. There is a different way if the surgeon is there, or if the medical oncologist is the one that takes care of the case. So these are difficulties that make that our way of treating the patients has to encompass all that. So in this case, what we're going to do is taking that into consideration and treat the patient, as Hahnemann said, as a unilateral disease with the local tumor symptoms playing a role, with the totality of symptoms managing the full decision of what remedy is going to be for the patient, and that the miasmatic approach, it's probably something that needs to be taken into consideration along all the history of the patient, because we're going to lack a lot of symptoms. We need to search on previous years for these mental symptoms to add more symptoms and finally decide what's going to be the best remedy for the patient. And from this point, we follow also the theoretical basis of Grimmer, that uses as symptoms, as the first grade symptoms, that would be the strange, rare, and peculiar. They're going to be the most useful in order to decide which is the remedy for the patient. In a second degree, the mental and the modalities, and then the common symptoms, where it lays probably the symptoms of the disease, because the disease is going to have these symptoms, but those symptoms are not going to be the most important in order to ask for the right remedy. And then the totality of symptoms. We need to consider that all symptoms of the current disease, the one that's been cured, along with all the totality of symptoms of the patients, need to be there and need to be a complex of perceptible signs of the disease. And all these symptoms have to be considered to decide what remedy is the best one. We also follow the Spinetti approach for advanced or metastatic cases, constitutional anamnesis, and miasmatic and familiar anamnesis of the patients, analysis of the suppressions, all this toxicity that had the patient has to be dealt in terms of foods, contaminants, the oncological treatments also as toxicities, and evaluate if there is a previous toxic treatment needed before to initiate the constitutional remedy. So in summary, we're going to have a disease that has very few symptoms. The miasmatic approach is very important. We have to deal with the local tumor symptoms, not in order to ask for the remedy, but to deal with those symptoms, because are going to be important in the quality of life of patients. We have to take care of the suppressions and toxicity, and we may use the emotional conflict that lays behind all the cancer patients as a source for mental symptoms. And then a few slides that are going to express that we also use this metabolic approach in terms of the complementary treatments, the fasting diets, keto diets, the probiotics, the curcumin, and some others, intravenous treatments, high doses of vitamin C, curcumin, etc., that are used in a weekly basis, concomitant to the patient. Those are approaches that are very well tolerated with very few interactions. Those are treatments that probably are not going to suppress the patients, or are going to suppress less than the chemotherapy treatments. And there are evidences that can help as a complementary way for the patients. Another use that we are dealing and that we are using for the patients is the local hyperthermia. Hyperthermia is a treatment that's very well supportive to the patients. Is not aggressive. It enhances the immunity. It activates the immunity against the tumor without making any harm, without toxicities. It helps to the tumor to be more open to complementary treatment and to also conventional treatment. So it has an increase of penetrability inside of the tumor and allows us to minimize side effects of these treatments. So in our institute, we've been dealing with a database of 1,200 patients in the last 5 years. Here are the numbers. In the last 5 years, we've dealt with 949 first visits, which are in oncological cases 700, and in non-oncological cases 248. You see here the numbers of the IV treatments and the hyperthermia that's used along with the visits where we have selected the main remedy for the patient. The results, we are not going to describe results in terms of survival because there is a mixture of treatments that we're going to do here with our patients, and we cannot attribute the good results that we have to one single action, but the combined actions of the conventional treatment, of the complementary treatment, and the homeopathic treatment. But we have to say that in overall, the quality of life, the percentage of reduction of side effects is 82%. All patients were included in at least 2 lines of treatment, meaning 2 of the 3 groups that we consider homeopathy, complementary treatments, and conventional treatments. Only 50% of the patients did not follow any conventional approach, considering conventional approach as the oncological conventional treatments, chemotherapy, radiotherapy, or surgery. None of our patients followed only one single line of treatment, homeopathy included. None of patients had only homeopathy. And now we're going to describe one case that may show us which is the objective that we have obtained in this case. This is a patient, a 54-year-old female with a stage 3 ovarian carcinoma that was operated, so had surgery, and then rejected adjuvant chemotherapy that was mandatory in her case, because stage 3 ovarian carcinoma is a tumor that is spread inside the abdomen and needs, from the conventional point of view, adjuvant chemotherapy. The patient decided not to do it, came to us, and we offered her the combination of homeopathy plus vitamin C intravenously and oral taken supplements. So the case is a patient that start detection of the hair cancer after her dog died. She is a patient that was feeling guilty with how she treated her daughter, because she was in a shelter for battered women. She was a woman that was mistreated, had some abuses along in her life. She's an introverted woman with very spiritual since the brother died. She had some paranormal phenomena in her history. She was interested in meditation, in different therapies, in transcendent. She's a healthcare worker, burned with a burnout. She's a victim of sexual abuse 3 times when she was a child. And for her, she takes cancer as an opportunity to confront life from a different point of view. She was divorced with a difficult relationship with men after the abuse. And well, she likes sweets, she needs nature, the noises alter her. The most important thing is to be at peace with herself, love herself, spirituality, and transcending things of life. We repertorize this patient, as you can see here, and those are the rubrics that we take as the most important. And here it comes lacumanum as one of the remedies that we felt that was the most indicated in her case. We gave her lacumanum at 200 CH potency, and she felt that that their changes were almost, she was referring that as almost magic, taking the homeopathy and then returning and have structure inside herself, power with her partner, she decided to split up with this partner that was not that was having difficulties with him, and she wanted to be strong enough to taste the life alone. She was very with a new dog, and she felt very well. In the next control, she was improving all the small symptoms that she had, and we increased the potency at 1000 K, and now is 3 years after all that, and she has no recurrences of this stage-free ovarian carcinoma. So in conclusion, interactions between different approaches of cancer treatments are a reality in our Western world. Homeopathy, we consider there is the holistic approach for treatment of the patient that, as we show here, is feasible and successful. And we also consider that complementary approaches and impact of conventional treatment should be integrated in our daily practice. And I'd like to thank you, my masters, and all the people that works in our center, because as you know, the old say, we are at shoulder of giants. So we are based on the big masters, and this is how we can construct the future. So thank you very much, and I'll be ready to take questions when you think that it's necessary.
Thank you, Dr. Juan. Now I would like to request the chair, Professor Delaire. Sir, any queries?
Yes, thank you very much, Dr. John Vidal Joe, for your nice presentation. The cases are nice, and how you approached to the cases with the results are excellent. It's just that I have a question and comment for your, I mean, it's also good to integrate homeopathy to the conventional type of treatment, and also to the diet, I mean the nutrition. But as for me, nutrition should be, I mean, in this case it worked well, but you have to be very careful with the diet, because not all keto diet works with the same type of cancer, nor some other diets that you used, fasting, etc., etc. So you need to probably look also for the metabolic type and autonomic dominance of the patients, which may be very, very important at the end of the day when you're going to choose your nutrition. But apart from that, I like your study, and I congratulate you.
Well, I completely agree with you. We think that keto diets are very good for patients with brain tumors, and because there's enough evidence on that case, and not all the patients react the same with the nutritional approach. That's very right. And we try to personalize it, but we believe that a metabolic approach is probably the right way to do. When we do the keto diet, we adapt it to the patient. We don't do a strict keto diet treatments, keto diet nutrition approaches to all the patients, but we reduce carbohydrates the most that we can. And this is probably what we think that should be done. Then related to fasting, we think that fasting before the chemotherapy, the day before the chemotherapy, is very good to improve side effects of the chemotherapy. And this is the works of Dan Longo and their group that show that. But also, as you say, we need to personalize and not to apply it as you know, one medicine to all the same.
We would like to call upon our next speaker. We have Dr. Mini. She will be speaking on a study to assess the efficacy of arsenic album in the treatment of acute gastroenteritis by gastrointestinal symptom rating scale. Dr. Mini is working as Associate Professor in Father Muller Homeopathic Medical College, India. Over to you, Dr. Mini.
Good evening, everyone. Good evening, everyone. So I will be presenting a small topic. It's a study which is done in our Homeopathic Medical College in Mangalore. The topic title is a study to assess the efficacy of arsenicum album in the treatment of acute gastroenteritis by gastrointestinal symptoms rating scale. So here I would like to start with the introduction. Already all knowing the introduction of the gastroenteritis. It is nothing but an acute infectious disease of the stomach and the intestine. And also we know there are sets of symptoms are there which clinically we can diagnose it. Mainly we'll be having diarrhea, vomiting, abdominal cramps associated with, there will be nausea. In some of the cases when there is severe, we can see there will be fever and chills. And also severity of the gastroenteritis varies from sudden diarrhea to a severe dehydration. And until and unless we get the severity, some of the people, they don't take care, like they will take it as a casual things. And also there are different causes are there. That is numerous viruses, bacteria and parasite can cause a gastroenteritis. Also, if you take the gastroenteritis disease as it is, what WHO has stated that it is one of the important disease which we have to take care, because 1,000 million cases of acute diarrhea annually in developing countries. And also we can see so many deaths because of this, especially in children and also in infants we can see. And already we know that arsenicum album is one of the important remedy in our homeopathic metamedica, which has got lots of indication in that GIT is one of the sphere of action where we know there will be a diarrhea and the order of the discharge or the stool will be very putrid. And also marked periodicity is there. Along with that, we know there are some ailments factors are there. There are some ailment factors like decayed food or non-vegetarian or animal matter, whatever, like after eating that, if you are getting a GIT symptoms or acute gastritis, this is one of the important remedy which we can give to our patient. Here also, we have taken a names and objective because so many cases we are seeing in our OPD, in our hospitals. So we thought we'll do a study on this. The aim of the study was to assess the effectiveness of arsenicum album, especially in gastroenteritis by using a scale, rating scale, that is gastrointestinal symptom rating scale. And also scope of homeopathy in treatment of acute gastroenteritis. And here we are to understand the approach of homeopathy in cases of acute gastroenteritis. Especially, we have taken the patients from our OPD. And we have used materials and methods. We have went with the study done in a systematic way and the help of certain materials and methods. So source of data, already I have mentioned about the source. It is like we have taken the cases after interviewing the patient and we have diagnosed the cases of, we could find out the cases with gastroenteritis. Clinically, it is diagnosed. And also the patients who were visiting our outpatient department. And also we have certain inclusion and exclusion criteria, and we have taken different socio-economic background. So the sample size were 15 cases of acute gastroenteritis, and all the cases were selected according to a inclusion and exclusion criteria. There are also inclusion criteria. We have added the age group. Age group, like we didn't keep any limitations because all the age group it will be effective. And also both the sexes we have taken. And also like only the cases where while taking the symptoms, while taking the totality, we could find like arsenicum album is indicated. And also there are some exclusion criteria with the like cases where we could not get the proper follow-ups, those things we have excluded. And also patients who had taken the medicine, previously medicine from other systems, like not only Ayurveda, Unani, also those who have taken the allopathic medication, those patients we have excluded. So with this study, there are certain methods we have applied. So here, first already I have mentioned, we had interviewed the patient and also we have clinical examination have done. And here I want to mention, we have not kept any control group. No control groups were kept for the study and it was done in the outpatient basis. The main important factor which we have included is the gastrointestinal symptom rating scale. We have prepared a questionnaire. In that we have validated questionnaire was there and also self-administered questionnaire. Like it includes 15 questions. And the severity we could find. There are 7-point scale in 5 domains. here I want to show the symptoms or the gastrointestinal symptoms rating scale. These are the few criteria, and we have, whenever patient came for the first time, and also for the follow-up, we had a questionnaire we have asked with the patient, and we have rated the severity of the symptoms. So here mainly few important symptoms which already I have mentioned in the first slide in the introduction part: abdominal pain, also some of the GIT symptoms like heartburn, acid regurgitation, nausea, vomiting, and character of stool, and the frequency of stool, and also urgency. These are the 15 questions or 15 symptoms which is there in the gastrointestinal symptoms rating scale. So with this, we have evaluated 15 cases, and after evaluating the cases, like after taking the detailed cases with the clinical examination, we could diagnose, after diagnosing the acute gastroenteritis, where the arsenicum album is indicated. For that, also we have done the repertorization, and we have done proper reference with the materia medica. And also potency, we have selected like range of potency from 30 to 1 we have used in this. We have considered the acute nature of the disease, susceptibility, vitality, also if there is any suppressions. According to that, potency is selected from 30 to 1. Here in this slide, you can see the there are some markings are there, like symptoms. If no symptom, we are marked it as 0, and the mild symptom will be 1, 2 is the moderate, and 3 is the severe. So according to this gastrointestinal symptom rating scale, we have interviewed each patient, and we could find out the scale before the treatment. Here I'm showing one of the scale of one of the patient where we could see it was 23. And this is after treatment, we could see that the scale, the scoring criteria is 4. Here also, after that, like after the treatment, during the follow-up, we have taken the scoring criteria, and we could see the scoring has come down. And here also the 4 parts are there: 0, 1, mild, 2 moderate, and 3 is a severe scoring. Okay. So for this study, we have applied research hypothesis. Research hypothesis is homeopathic treatment is effective in cases of acute gastroenteritis. Also, we have a null hypothesis: homeopathic treatment is not effective in cases of acute gastroenteritis. So with this hypothesis, we have selected 15 cases. Here we can see like the before treatment and after treatment scoring criteria, scoring marking, we can see there is a drastic changes before and after. So this is the observation and result we could find. And with this values, there are 2 values. So we are gone with the pre and post values, and we have done a paired t-test. And with this, we could get we have calculated the mean standard deviation, and also like we have got a important p-values we got. So here we can see in the value, it is highly significant. And also statistical result, like quasi-experimental study was conducted on 15 patients with paired t-test, and before and after treatment values have taken. And here we can see the p-value is 0.0001. Since p-value is less than 0.001, the null hypothesis is rejected. So this is the outcome of the study. Out of 15 cases, we could see the age difference, like 16 to 20 years of age people are more affected. And also we can see like 14 people have responded well within the first follow. And also in the treatment of acute gastroenteritis, the favorable outcome we could see the efficacy of, this is my conclusion, the study reveals efficacy of arsenicum album in treating cases of gastroenteritis. This is my references, bibliography, and also I would like to acknowledge my college, Medical College, Fadamulla Homeopathic Medical College, and also LMHI people for giving me opportunity to present the study. Thank you.
Thank you, Dr. Mini. Professor Delaire, sir, please.
Yeah. So, Dr. Mini, thank you for your presentation. Did you have any repertorization that you can show us?
Yeah, because sir, slide number, because of time limit and slide number, I could not include that in that because 10 minutes, there was some limitation, sir.
So, and can you tell us why you have chosen arsenicum album and not other arsenic remedies? Because
There are so many
normally in
remedies.
classical homeopathy, I mean, we are not prescribing with like the allopathic medicine, right? I mean, here you say, I mean, your conclusion is somewhat like if you have acute gastroenteritis, use arsenicum album, which might be, if you choose another group of patients, might be a little bit misleading. So just take that conservation. Apart from, I like how you present it, but this is a really serious concern that we need always to take patients personalized, get their totality, etc. There might be some of the symptoms which can be translated into rubrics which can be common to acute gastroenteritis picture with arsenicum album, but without doing this, this would be a little bit question mark. But thank you anyway for your presentation.
Okay, sir. There are so many other remedies are there, sir, but thought we'll start with the arsenicum album. Maybe in the future, we have to do with the other remedies also, like with the large scale of sample size, sir. Thank you very much, sir.
Thank you, Dr. Mini.
So the next speaker is Dr. Behvish Dondarty. He will be presenting a case on the scope of homeopathy as a complementary and integrated form of medicine on quality of life of patients of end-stage renal disease on hemodialysis.
Hello, everyone. Thank you so much for allowing us to be part of this presentation. I'm really happy and really indebted to this whole organizing team. Okay, I'll just start. So my topic, as you've already introduced, is the screen visible?
Yeah, yes, ma'am. Please, can you please enlarge it? Yeah, thank you.
Okay. So basically, this study of ours, when we started off, end-stage renal disease, basically the name itself suggests that, is the end where maximum of the nephrons are damaged. The basic filtration process, which was supposed to be 90 ml per minute, has come down to 15 ml per minute. So this just suggests the level. Creatinine levels cannot be more than less than 2.5, and there's n number of uremic symptoms. So basically, it's the end where you cannot have any other, you don't have any scope left, and the only management which we have for such cases is hemodialysis. The major causes of end-stage renal disease is, as we already know, so many studies we have already seen during this whole presentation. The diabetes and hypertension amount to almost 65%. And in India, almost 129 million per population. The study in 2018 suggested that these are the number of people who undergo dialysis. Hemodialysis is the most common and most feasible way of managing the dialysis, and 2/3 of this population, when they are unable to actually go through dialysis, expire. So you just that is the present scenario when we talk about end-stage renal disease. Now, why the need to study something of this sort? Basically, when we go for the hemodialysis, that is the only present management apart from renal transplant. But there is a downward trend in the quality of life when we see with the patients of dialysis. So basically, there is dialysis, but can we call it as health? So the study, when we started, had these questions in mind. And then the WHO, basically, when we talk about quality of life, is an individual perception of their position in life in context of culture and value system in which they live in and relate to the goals. So you can just imagine an individual perception is nothing. It's very difficult to work on something when we talk about quality of life. So the question arose, what can we do, homeopaths? There are patients coming up and saying, ma'am, can we get rid of the dialysis? Can homeopathy do this? At that point of time, we actually did not have any answer because the literature does not have anything on ESRD, nothing in homeopathy. As basically, no answers were actually found. So we started thinking, can there be anything done in this respect, you know? Because the end stage renal disease, and then there is no nephrons left, pathologically irreversible changes have taken place. So what can we actually do when there is no vitality left in patients? The objective of a study was to ascertain the improvement in the quality of life of patients with homeopathic medicine as a complementary to the present management of hemodialysis. We did an uncontrolled single-blinded prospective study with a minimum sample size of 30 patients who were randomly selected in the age group of 26 to 70. All the patients of ESRD who in our unit of Dr. M.L. Dhawale Homeopathic Hospital at Palghar, whatever patients were available, all those who were on the hemodialysis in past 1 year were taken into the study, who were able to read and write. They were administered homeopathic constitutional remedies based on Kentian or Bonnie-Hosson's approach whenever it was applicable, and the scale of potency used was 50 millisiemental scale. And these medicines were administered along with the present management of hemodialysis, the frequency of twice or thrice a week dialysis. The instrument used to assess this was kidney disease quality of life short form version 1.3. It is a scale which has a questionnaire of 24 main questions and which has various domains, and the 12 domains were particularly covering the main area of ESRD targeted questions, and there was 36 column where there was health related quality of life survey. So there were two sections in that kidney disease quality of life, while the blood parameters were separately assessed. So these are the list of symptoms, problem list, effect of kidney disease, workstations. So all these were the different parameters where ESRD targeted areas were assessed, and then there was health related points, and then there were blood parameters which were assessed separately. Data was analyzed, 2 sets of data was there, and since it is a qualitative study, we went for Wilcoxon sign rank test, and statistical significance in the various domains were assessed separately, where p-value was less than 0.05, and then statistic and non-centrality parameter was assessed. These are all the statistics which we did with standard deviation of 1. The observations which we could find was basically larger group of people coming from 51 to 60 age group. Various other risk factors responsible for ESRD along with diabetic nephropathy and hypertension was surprisingly this interstitial nephritis and glomerular nephritis. So which we found it weird, because chronic UTIs lead to ESRD also in 30% of cases. Another surprising observation was that the clinical depression was found in 20% of the cases. What we finally, after the statistical analysis, we found that there were these following areas where there was statistically significant change. In pain parameter, the parameter of problem or the list of symptoms which the patient feel, the sleep, the effect of kidney disease, the emotional well-being, the social function. Along with that, there was statistical significance in the cognitive and effect and the energy. Along with this, there was statistically significant change in changes in physical function, while there was no changes in social support, blood parameters, or the other conditions like work status, patient satisfaction, serum creatinine levels in statistics. However, clinical effect, there was small clinical effects seen in these parameters as well. The blood parameters were also seen to have were found to be having some small clinical effect as well through homeopathic management as a complementary. So thus, out of say 9, there were statistically significant changes in 9 out of 19 parameters. 6 out of 10 ESRD targeted areas shown results. Clinical significance of 12 out of 19 parameters were seen. No statistically significant changes were seen in the blood parameters. So what basically we saw was improvement in the subjective symptoms. The vague pains, post-dialysis, pre-dialysis, muscle cramps, numbness of hand, chest pain, dryness of skin. These are the list of symptoms which patients are really troubled, which has no solution as such when patient go through dialysis. There was improvement in sleep. Sleep improvement means the initiation of sleep, the number of hours the patient slept with soundfulness and restful feeling. Patient could sleep during the night and not during the day. Socialization improved in the sense improvement and ability to mix with people, socialization skills like smiling, talking with eye contact, such socialization and the factors also improved, which was assessed through the scale. Emotional well-being was improved, better psychological health was observed, improvement to desire to work, desire to be involved with friends were also experienced. Blood parameters, although it never came down below 2.5, but there was an overall stability in the serum creatinine levels. So, which just indicated a good dialysis compliance. So, when a 6 milligram of DL of creatinine level is considered optimum, with a good twice a week or thrice a week dialysis, and these levels, a nephrologist would consider this to be a optimum level. Your dialysis is going on fine and there is least of symptoms. And there were other factors like blood pressure stability, post dialysis, and reduction in hypotension. So such symptoms were also improved. So basically what we saw was the significant improvement in the quality of life of patients of ESRD who are on hemodialysis. And we see that homeopathy has a great scope when it moves along as an integrated form of medicine as well. Because when we talk about quality of life, the patients, it is a very qualitative feeling, very non-materialistic, we cannot measure it. But yet this just opened the doors for future scope of homeopathy in other lifestyle disorders and diseases where the management has nothing else to do with. I would like to thank the team and my institute, ML Dhole Memorial Hospital, for giving me the scope and being able to manage such cases where dialysis patients are actually out of reach for any homeopathic practitioner in such scale and number. So I'm thankful to them as well as the organizing team for allowing me to share my study. And this is first stepping stone to understand where all homeopathy can work. Even when there is homeopathically structurally advanced cases, when there is no hope, there is still some hope for patients. Thank you.
Thank you, Dr. Mahwish. It was quite an interesting presentation. It would be a great boon to patients on end-stage renal disease on hemodialysis if homeopathy can be used in such a manner. I now request the chair, Professor Dillard. Sir, any queries?
Can you just tell me if you have used any homeopathic remedies with the end-stage renal diseases? And did you have any repertorization that you can share with us?
I will need some time to share the repertorization, but what we basically went through, we used Natrum muriaticum, Lycopodium, and we used Kali card, many such constitutional remedies. See, basically there were very less of symptoms per se. When patient shares, there is very less of symptoms, but then there were ailments from which we generally used to pick up, like ailment from business loss or loss of position. And with that, few physical symptoms. Considering the pathology, there was generally a lot of paucity of symptoms. So what we could get was only 4 or 5 symptoms at the maximum. And then we used to repertorize. And then based on the constitution of the patient or the basic tendencies of the patient, we gave the remedies. So, so that was the way we managed the cases. Like in one case of Lycopodium, where there was a significant downfall of the patient when the patient had a major business loss. So we took that as a rubric. Along with that, the basic tendency of nephrolithiasis as a chronic complaint. He often had a calculi formation. And then what we got was affection of kidneys. These were 2-3 symptoms which we picked up. and we got lycopodium as a remedy. So such way, we have done many other remedies, many other totalities in the patients.
So, Dr. Mehvish, thank you very much for your presentation. I would very much like for the next meeting to share hands-on application of your treatments and remedies so that we can have an understanding of what works and what doesn't work, because this is just a sort of generalization and it's difficult to draw definitive conclusions from what you have already presented, but thank you anyway.
Thank you very much.
Thank you, Professor Diler.
Okay, let us introduce our next speaker, Dr. Olga Pedrunova from Russia. We will request Dr. Olga to please share her presentation.
Да, благодарю вас за возможность выступить перед вами, коллектив авторов. Космодемьянский Леонид Владимирович, вице-президент Международной гомеопатической лиги по России, трудится в Москве. Елена Михайловна Долгова, она вице-президент Российского гомеопатического общества, трудится в Саратове. Я вице-президент по Сибирскому федеральному округу Российского гомеопатического общества. Мы находимся друг от друга на 1000 километров. 3000 километров меня разделяет с Москвой. Елена Михайловна с Леонидом Михайловичем разделяет 1000 километров. Но нас всех объединяет одно стремление сделать гомеопатию доступной в России на территории 17 миллионов квадратных километров. В настоящее время недостаточно бывает обобщенных данных о применении гомеопатического метода в клинической практике. Значительно чаще встречаются описания в специализированной литературе редких клинических случаев. В данной работе была сделана попытка обобщить опыт врачей, использующих гомеопатический метод при заболеваниях пищеварительного тракта с учетом международной классификации болезней 10-го пересмотра. Авторами была разработана оригинальная анкета-опросник Google форма и был проведен опрос 120 врачей, которые используют в своей практике гомеопатический метод лечения и применяли его при заболеваниях пищеварительного тракта. Опросник проводился с использованием современных средств коммуникации через приложение WhatsApp. Первым вопросом предлагалось выбрать класс заболеваний пищеварительного тракта в соответствии с международной классификацией болезней 10-го пересмотра, при котором доктора использовали в качестве лечения гомеопатические препараты. На первом ранговом месте по обращаемости к врачам-гомеопатам стояли пациенты с болезнями полости рта, пищевода, желудка, двенадцатиперстной кишки, болезнями печени, желчного пузыря и поджелудочной железы. Затем следуют неинфекционные колиты, энтериты, другие болезни желудочно-кишечного тракта и кишечника. А вот грыжи, болезни брюшины и болезни аппендикса составили всего 25% от обращаемости к нашим докторам. Клиническое мышление, уточнение деталей, диагностический поиск формируют логику назначения определенного спектра диагностических исследований для того, чтобы был назначен полный комплекс гомеопатического лечения. Под словом «комплекс» подразумевается не столько назначение комплексных гомеопатических лекарственных средств, но в первую очередь поиск комплекса конституциональных, индивидуальных особенностей и признаков через осмысление данных объективного и инструментального исследования пациента. Для уточнения и дифференциального диагноза болезни пищеварительного тракта все врачи, владеющие гомеопатическим методом, используют современные методы диагностики и обследования пациентов с заболеваниями пищеварительной системы.
Dr. Olga?
Да.
Yeah. Please keep on changing your slides. It is still in slide number 1.
Не поняла? I don't know.
Dr. Olga, I think you need to change the slides also as you go on with your presentation. Your slide is still at number 1. Yeah.
Yeah,
Yes?
now. Yes. Yes, yes.
Yes, yes.
Yeah,
Мгм,
yeah.
мгм. Да, отлично. Используют все методы современной диагностики. И гастроскопию, и тест на геликобактер, компьютерную томографию в разной степени частоты, в зависимости от клинической ситуации, диагностических и материальных возможностей различных регионов нашей страны. В ответ на вопрос, при каких стадиях заболевания пациенты обращаются к врачу, владеющему гомеопатическим методом, ответ был ожидаемый. Более 87% пациентов – это пациенты с хронической патологией желудочно-кишечного заболевания, пищеварительного тракта. И только в 12%, чуть больше, 12,5% пациентов обращались к врачам, владеющим гомеопатическим методом, при острой патологии желудочно-кишечного тракта. Под острую стадию никто из опрашиваемых респондентов не выделил. Статус гомеопатии в нашей стране определяется действующим приказом Минздрава от 29 ноября 1995 года номером 335 об использовании метода гомеопатии в практическом здравоохранении. В соответствии с этим приказом коллегия и Бюро ученого совета Минздрава России разрешили использовать гомеопатический метод в государственной системе здравоохранения. Была утверждена нормативная документация, регламентирующая деятельность врача, использующего метод гомеопатии. Было разработано положение о враче-гомеопате, о враче, использующих гомеопатический метод. Были разработаны правила отпуска гомеопатических препаратов с требованием к заполнению медицинской документации при амбулаторном обследовании. Было принято решение обеспечить последипломную подготовку врачей-специалистов лечебного, педиатрического и стоматологического профиля по гомеопатии. Но с того времени, когда был принят этот приказ, произошли организационные и экономические изменения в системе российского здравоохранения. Это наложило определенный отпечаток на мнение российских врачей о доступности гомеопатии в системе государственного здравоохранения. И поэтому 40% опрашиваемых коллег нашей страны убеждены, что в государственных учреждениях здравоохранения России запрещено применение гомеопатического метода. Теоретически нет документа, который бы запрещал применение гомеопатии в государственных медицинских учреждениях. Но формирование такого мнения, скорее всего, связано с тем, что применение гомеопатических лекарственных средств на сегодняшний день не оплачивается из средств государственного бюджета, и средств Фонда обязательного медицинского страхования. Реалии таковы, что услуги врача-гомеопата, приобретение гомеопатических лекарственных средств оплачивается только средствами граждан. Определенным образом на это умозаключение повлияло и то, что гомеопатический метод на сегодня не входит ни в стандарты, ни в порядки, ни в клинические рекомендации. И поэтому законным образом ограничивает творческий подход к индивидуальному гомеопатическому лечению пациентов в широкой государственной практике, в отличие от частной. 50% опрошенных российских врачей, работая с патологией пищеварительного тракта, назначают гомеопатические монопрепараты. Четверть опрошенных специалистов используют в своей практике для лечения заболеваний органов пищеварения и комплексные, и моногомеопатические препараты. 12%, 12,5%, в клинических случаях было применено сочетание аллопатического лекарственного средства с назначением гомеопатических лекарств. Такая же доля специалистов используют для лечения этого класса заболеваний только комплексные гомеопатические препараты. Опыт лечения заболеваний желудочно-кишечного тракта в хронической стадии с использованием гомеопатических лекарственных средств позволяет добиться быстрой положительной динамики. Более 37 респондентов отмечают положительные сдвиги через неделю примененного лечения. Около 40% врачей отмечают улучшение состояния своих пациентов в течение 2 недель. Четверть опрошенных врачей констатируют положительную динамику в развитии симптомов этого класса заболевания в течение 1-го месяца. Вызывает оптимизм и радует, что при анкетировании на вопрос о результатах лечения 100% респондентов, докторов, указали положительный результат исхода терапии. Из этого можно сделать вывод, что все варианты сочетания гомеопатических лекарственных средств при заболеваниях пищеварительного тракта и моно, и комплексов, сочетание между собой и с аллопатическими препаратами имеют всегда положительный эффект при заболеваниях этого класса. Быстрые сроки улучшения течения хронического заболевания желудочно-кишечного тракта, использование современных методов диагностики, высокий профессионализм врачей, использующих метод гомеопатии, вне зависимости от того, используют ли они моно- или комплексные гомеопатические лекарства, сочетание между собой, то большинство пациентов вновь обращаются за помощью к этому же врачу-гомеопату в связи с ухудшением своего здоровья по поводу какого-то другого заболевания. А с этим заболеванием возвращаются на фоне хронического течения 12% опрошенных пациентов. Таким образом, это можно расценивать как доверие пациента и к методу, и к врачам у полиморбидных пациентов с хроническим течением заболевания. Применение гомеопатического метода у пациентов, страдающих болезнями пищеварения, высокоэффективно, как с применением монокомпонентных гомеопатических средств, так и в сочетании с комплексными гомеопатическими лекарствами, аллопатической терапией, и обуславливают положительную динамику в течение 2 недель лечения, как правило, выявляет выраженную приверженность к лечению хронических полиморбидных пациентов. Существует, к сожалению, недостаточная осведомленность врачей о правовом статусе применения гомеопатического метода в системе здравоохранения Российской Федерации. Но, на наш взгляд, наша работа будет продолжаться для того, чтобы уточнить еще очень много-много данных в связи с этими организационными проблемами с одной лишь целью, чтобы врачи имели право практиковать искусство и науку гомеопатической медицины, не опасаясь ни возмездия, ни цензуры, ни клеветы, ни каких-то других репрессивных мер. И мы думаем, что вслед за этим опросом последуют какие-то позитивные наши заключения, и мы позволим в Российской Федерации войти гомеопатическому методу лечения в клинические рекомендации, в государственную, ну и в частную практику, где сейчас превалирует гомеопатический метод. Большое спасибо вам за внимание. Благодарю вас за возможность выступить с нашими наблюдениями, с нашей работой перед такой аудиторией. Благодарю вас.
Thank you, Dr. Olga, for your presentation. Now, I would request Dr. Diller to share his comments on the presentation.
I mean, it's just that as this is not a study, this is just picturing the status of homeopathy in Russia. So I really don't have comments. I just share her concerns, that's all. But this is not a study, so that I cannot comment anything on that. But thank you very much for sharing the status in Russia.
Thank you, Dr. Diller.
Okay, our next speaker is from Spain, Dr. Jose Luis Espejo Lozano. Dr. Jose will be presenting the topic, Homeopathy, Medicine for the Health of the Population and the Planet. Dr. Jose? Yeah, please share your screen.
I will speak in Spanish. Hola, buenas tardes. Ante todo, muchas gracias. Bueno, como decía, esta ponencia trata sobre la dimensión social de la homeopatía. y ha sido realizada por el Grupo de Trabajo de la Asociación de Médicos Homeópatas de Andalucía y Extremadura.
Kindly share your screen, please.
Desde la creación de...
I'm sorry, if you need any translation, please please let me know and I will translate your presentation. Yo puedo traducir la presentación, doctor José Luis. Para mí es un honor.
Sí,
soy la doctora Cecilia Plaza.
Muchas gracias. Desde la creación del sistema médico homeopático por el doctor Samuel Hahnemann en el año 1810, con la publicación del Organón del arte de curar y las posteriores materia médica pura y tratamiento de las enfermedades crónicas, a la comunidad médica y a la población en general, la homeopatía ha venido presentando un gran servicio social, muchas veces no considerado por diferentes intereses, como ya sabemos. La investigación y desarrollo progresivo de la ciencia homeopática a través de 211 años transcurridos con su utilización eficaz y eficiente en el tratamiento.
Dr. Jose,
sí.
Kindly share your screen, please. Dr. Jose, please share your screen, please. It is not visible to us.
Sí.
You will be sharing your screen.
Perdón.
Cecilia, can you please help Dr. Jose to share the screen? Yeah.
Tienes que, nos está mostrando tu pantalla, José Luis.
No.
No estamos viendo nada. Entonces pon compartir pantalla,
sí.
En el icono de abajo.
Perdón.
Ahí se ve muy bien. Ahora hay que poner modo presentación en el icono inferior, al lado donde sale 101%, abajo. O bueno, arriba también puede ser, ¿no? Cualquiera de las dos.
Bien. Bueno, como decía, una ponencia sobre la dimensión social de la homeopatía.
This is a ponencia about the social dimension of homeopathy.
La investigación y desarrollo progresivo de la ciencia homeopática desde hace ya 211 años, con su utilización eficaz y eficiente en el tratamiento del individuo enfermo, a pesar de los diferentes obstáculos interpuestos en su camino, ha conseguido ser aceptada por amplios sectores de las sociedades en distintos países del planeta. Debido a los resultados obtenidos tanto a nivel de salud individual como a nivel de salud colectiva en el tratamiento de las diferentes enfermedades, y entre ellas destacamos por su connotación social las enfermedades epidémicas y endémicas.
Okay. From the beginnings of the homeopathy, there is a development in the healthcare for animals too, not only for humans. And nowadays, veterinarian homeopathy is very developed and very used in many countries. There is a huge and very strong way and performance about veterinarian homeopathy beneath homeopathy or homeopathy.
Desde los inicios de la homeopatía también se desarrolló y se difundió el empleo en el cuidado de la salud de los animales. Hoy en día la homeopatía veterinaria está bastante desarrollada y es utilizada en muchos países con una trascendencia social importante, pues tanto en el cuidado de los animales de compañía como en el cuidado de los animales de producción viene demostrando su validez y eficacia, reafirmándose la homeopatía veterinaria como una rama eficaz de la homeopatía.
There is a lot of advance in veterinary homeopathy, as we said before, and there are a lot of progress in understanding funding studies about how to implement homeopathy in veterinarian healthcare.
Posteriormente, su aplicación se ha ido extendiendo al cuidado de las plantas y a la producción agrícola, demostrando eficacia a la hora de tratar plagas, enfermedades de los vegetales y está demostrando poder mejorar las especies y la fertilidad de los suelos. Se constituye así una rama de la homeopatía conocida como agrohomeopatía, con gran trascendencia social.
There's an area of development of homeopathy, of veterinary homeopathy, that it's called agro-veterinary homeopathy, and it's have proved a lot of help in developing social healthcare. José Luis, nos están pasando las diapositivas. Si quieres, puedes poner presentación pantalla, modo presentación, así van pasando las diapositivas.
Las estoy pasando.
Se ven fijas. No, está en la número 9.
Tanto la veterinaria homeopática como la agrohomeopatía hoy en día suponen una realidad a la hora de poder disponer para la sociedad de una producción y mejora de alimentos ecológicos y libres de toxicidad química, junto con la utilización de la homeopatía a nivel humano, reduciendo el consumo de fármacos químicos y el exceso de antibióticos, utilizados tanto en personas como en animales y plantas, así como la reducción de la utilización de estas últimas de pesticidas, herbicidas, fertilizantes químicos que podrán contribuir a una mejora bioclimática del planeta, disminuyendo considerablemente la carga tóxica de suelos, aire y agua. Todo lo cual redunda en un gran beneficio social. Hemos de añadir, finalmente, la utilísima función social solidaria que la homeopatía cumple y está llamada a cumplir, siendo el medicamento homeopático un producto económico con facilidad para transportarlo, incluso se puede preparar en otras diluciones y potencias a partir de la cintura madre en el lugar donde lo necesitemos, se constituye en un verdadero soporte facilitador de la aplicación de medicina homeopática para que los profesionales sanitarios puedan realizar su función curativa, preventiva y paliativa en la población de países con bajos recursos económicos a través del sistema homeopático, procurando una curación pronta, suave y duradera, libre de toxicidad y de contaminación de una forma totalmente ecológica. El presente...
I'm sorry, José Luis, it's a huge role of this agro homeopathy because we can reduce use of drugs, pesticides, herbicides. So the development of this area should be a big issue for global healthcare.
El presente estudio recopilatorio tiene como finalidad principal identificar las diferentes utilidades de la homeopatía a nivel social para concienciar a la población de la necesidad de desarrollar y defender la misma, dados los altos beneficios que reporta a la sociedad. Hemos realizado una búsqueda bibliográfica sobre la temática propuesta, hemos consultado de distintas fuentes en Internet, hemos revisado bibliotecas, y con la información recogida hemos sintetizado las principales aplicaciones con resultados contrastados y hemos analizado y reflexionado sobre las medidas necesarias para poder llegar a una plena aceptación de la homeopatía por la sociedad, dada su utilidad.
The method, can you go before, please? The method used it's a bibliographic research of many database. ¿Puedes ir un poquito antes, por fin, para poder traducir lo que dijiste? The method, as I said, it's about research, bibliographic research about this theme, and we have used different professional blogs in internet. We have research video stores about these themes, And then we have analyzed and have a reflection about the necessary ways to go further for a plain acceptation of homeopathy for society, of the society. Vamos, dale nomás.
No me da tiempo, voy a tener que pasar.
Sí.
Bueno, me detengo en la función solidaria de la homeopatía. En el 2014 surgió el proyecto solidario promovido por el doctor Renzo Galassi, por el que intentamos reunir a todos los compañeros y proyectos activos a nivel mundial e intentar coordinar todos los esfuerzos para dar la mejor solución posible a la solicitud de ayuda de los países pobres para desarrollar la homeopatía. Tengo ya que ir al final. Y como conclusión, la homeopatía es un sistema médico universal para el cuidado de la salud de la población, animales y plantas, y conservador medioambiental y ecológico del planeta, que hay que defender de otros intereses que pretenden impedirnos.
Dr. Jose Luis says that, well, there is not enough time, so he needed to go further to the conclusions, that it's a big that it's a big opportunity to consider homeopathy in global healthcare. And if I don't know if the organization can give him more time because we have technical issues, more translation.
More than anything, Dr. Cecilia, we would love to hear Dr. Jose, but we have 2 more presentations and then we have another session as well. So we, unfortunately, we won't be able to have some more time. So can we request him to conclude so that we can move to the next speaker? Thank you.
Okay.
Thank you.
Bien, José Luis, no hay mucho más tiempo, lamentablemente, entonces quizás la última conclusión para seguir con las otras presentaciones.
Nada, no hay tiempo ya. Muchísimas gracias y perdón por las dificultades técnicas.
He says, thank you very much. Sorry for the inconvenience and all the technical inconvenience, but he loved to share lately more reflections.
Thank you, Dr. Jose. And thank you, Dr. Cecilia, for the translation. Professor Diller, sir, any comments?
Thank you for the presentation, for sure. It would be excellent if we could have the translations written side by side, because otherwise it's really difficult to follow. I have no further comments, but the only thing that I can say is that data is gold. What he is saying is very relevant for today's world, but this needs to be supported by data and with international efforts. That's all I'm going to say about him, and congratulate him on his efforts.
Thank you, Professor Diller.
Doctor Saper, José Luis dice que te felicita y felicita al equipo por todo lo realizado, que es un tema tremendamente relevante y que es importante seguir los estudios con datos en relación a los estudios, etcétera, y que felicita nuevamente a todo el equipo por todo lo realizado.
Thank you. Muchas gracias a ti sobre todo, Cecilia.
Thank you, Dr. Jose. And I think can we give a chance to Dr. Simonti if she's ready?
Hello.
Hello.
Request.
Time she will be able
to. Can you hear me? Hello.
Yes,
yeah,
you are.
Yes, you're on.
So we will now like to invite Dr. Juhi Gupta from India, and Dr. Juhi is assistant professor in Government Homeopathic Medical College and Hospital, Bhopal. And she will be speaking on the topic Big Data Revolution and its application for homeopathy. Dr. Juhi, over to you.
Yeah, good evening. Am I audible to you all?
Yes, you're audible.
So a very good evening to one and all.
It has been a pleasure to be with you, sailing in the beautiful, cases of homeopathy and well crafted. Let me come straight to my presentation. I am talking about a new technology which we still do not have in homeopathy. Rather, we do not have it in any of the medical disciplines in India. That is the big data revolution. But since it was one of the themes of the event, so I took it as my topic of presentation. So friends, as we know that in the current times, data is called the new oil. And this data is something which gives us not only a vision and understanding of today, but also of the times to come and the future of everything from consumerism to medical trends, to engineering, to technology. But what is this big data? And how is it different from the data that is already existing? So the big data is the data which has to be taken care of in a very, very systematic manner, involving very huge softwares to extract it, to analyze it, and to reach to certain conclusions. And then this data becomes the base of all the strategies, applications, and things that have to be planned for the times to come. Now, health data is going to be one of the biggest data across the globe. And as we all know, that the World Health Organization and the government of India as well are both very keen upon collecting the data for human welfare and to plan strategies in such a way that there is a control in the existing condition of healthcare and a condition where everybody can live in a more peaceful and healthier manner. So if we look at medical data, which on date in at least our country is not a big data, it can be divided into many categories. And we all know, as a part of our statistical learnings, that data can either be structured, unstructured, it can be explicit, it can be implicit, it may be patient care oriented, or it may be research oriented. But we have one more important segment, which is hospital medical records and biobanks. Now, this is a very important part of the data which is floating on the web. And this authentic, inauthentic data is going to form a very huge base of the times to come for strategy building for healthcare. Let me give an example that on the 27th of September this year, Honorable Prime Minister of India, Shri Narendra Modi ji, launched the National Digital Health Mission. Now, this health mission, as you can see on the screen, encompasses so much, and I would not talk much about it, but this is the first time that in India we are going to generate such a huge data of 10 crore already identified population. So we are heading towards this big data revolution in healthcare management, health mission in our country. And if at this point of time we align with them, develop verticals, and also interfere horizontally by manpower support or furnishing the required informations, then homeopathy, rather Ayush, will form a very important segment of this data. As we know that the real issues in our country are not what they are globally. We have a huge population to cater, and preventive and promotive healthcare should be the ideals of our healthcare management system, because treatment part becomes very difficult with such a big number. And so the public health initiatives have to be strengthened at the grassroots level. And here is where Ayush systems like homeopathy come into role, and they give importance to the person as well as his individual existence and happiness and health. So if you can see, the big data in healthcare can be used in different ways, and these are the different arenas in which this data can affect. We can also see on screen the sources of this big data, which are, I agree, different in different countries. There are more, more precise and more defined in the developed countries, but they are also very meaningful in countries like ours. But what is it that we can use this big data for? The applications. So besides diagnostics, there are areas like preventive medicine. There are areas like precision medicine, hyper-personalized care. Here comes homeopathy. Medical research is, of course, there. Reduction of adverse medical events, again, Ayush comes in. Cost reduction, very important for systems like ours. And population health, that is, we are talking about the well-being of the whole population. To sum up my observations regarding homeopathy, On date, we have got a lot of repertories and materia medicas and things on the software side, but we do not have anything which can be called as a big data or a data even globally. If we look towards this, the homeopathic fraternity across the globe has to create an assembly of data, a very well organized assembly of data, and has to use the data mining tools, has to clean the data, minimize and standardize it, and in a very, very systematic approach, apply it to all the segments where we can intervene and interfere, including genomics. Because in today's times, we can get the health history of the families by using this genomic data typing. So when we are in a position to do this with homeopathy, if globally even an organization like LMHI takes up a segment of big data management and say of only 4 or 5 of the segments, then we will be in a position to furnish clear-cut outcomes globally. And definitely we will be in a position to reach to every human being. Now, we all know that artificial intelligence is governing the whole human existence, and everything, including cosmetics, food, lifestyle, medications, professions, everything gives us inputs on homeopathic prescribing. So it is my earnest request to organizations like the Liga that when we are looking at developing homeopathy for the coming centuries and to actually deliver the services of systems like homeopathy to the masses, what we have to do is do a very rigorous effort, put rigorous efforts, come together, design standardized approaches, generate big data. And once we generate this big data, we will be in a position to come with outcomes, and there will be no question on our performance, our integrity, and the importance of our existing literature. This was all that I wanted to share about the big data. The major revolution in big data has been brought about by the FMCG sector. We all know Amazon, Flipkart, Walmart. We know the flights and railways bookings. But surprisingly, you all might not be knowing that the Election Commission has got an insight into the data of every house in a village. There are almost 250 variables of each village where they are working upon. And many of them can be of use for us. And laterally, vertically, we can enter into it and create a large system for homeopathy. My humble submission, I hope it was of use for the fraternity. It was a new topic. And this area, I think, is least represented or thought of in our system. So I would request LMHI to look into it further. Thank you so much.
Thank you, Dr. Juhi. It was indeed a very interesting topic. And now I would request Dr. Diller to give his comments.
So this is really an interesting topic, and I thank you for bringing up to the attention of Liga and other related bodies. We know that the use of business intelligence along with real-time data allows healthcare professionals to make more accurate diagnosis in an efficient and timely manner. And the use of big data is expected to grow in the medical field more and more in the coming days, not only in the conventional medical side, but also in homeopathy. And if we continue to pose lucrative opportunities for solutions that can help save lives. So thank you very much.
Thank you, sir.
Thanks are due to all the speakers for sharing their clinical experiences. I would also like to thank all the attendees and coordinators for the day, Dr. Swati, Dr. Harshita, Dr. Vismya, and also Sneha and team. Thank you all. Good day to all.
Thank you. Bye-bye.
Thank you so much, ma'am.